Are your clients struggling with stubborn muscle tension that just doesn't seem to shift? Well, positional release is one of the gentlest yet most effective techniques for calming the nervous system and reducing pain. And in this video, I'll show you exactly how to use it in your treatments. So what is positional release? Well, positional release is a gentle technique where you place the body into a position of comfort, usually by shortening the affected muscle. You then hold that position for around 90 seconds to 2 minutes. It works by reducing tension and quieting the nervous system, helping the body reset without using force or pressure. It's simple but incredibly effective. So who are we going to use this for and when are we going to use it? Well, it's going to work better for clients who are experiencing things like muscle spasms and are currently in quite a bit of pain, and it's also going to be ideal for nervous clients as well who are looking for fast results. Okay, we are going to be doing some positional release work today. And to kind of give you a bit of an idea about positional release, the simple answer is we are bringing the muscle into a position that encourages more comfort by effectively bringing it into a shortened position. So we're trying to get it to a point where it feels less painful for the client. So similar to kind of a trigger point, what we're going to do is find that area that is tender. So we're specifically going to be focusing on the traps at the moment. So as this kind of comes around, just let me know when this feels kind of like a tender spot for you.
Around that area definitely is tender. Or there.
There? Okay. So what we're going to do is we're going to apply some pressure to that. But what we want to do is we want to bring it into a position where it feels easier. So keeping to where that pain point is, so where we may have got that adhesion, an injury, whatever it might be, we're now going to look to shorten that muscle. And a couple of ways we can do this. It might be that we bring the traps into a shortened position here. So how does that feel? Does it ease off a little bit? What we would want to do now is hold that for at least 90 seconds. And again, we're not applying too much pressure, but we want to keep some pressure on there whilst we're doing this, because the purpose of a soft tissue release, the purpose of a positional release, shall I say, is to, I suppose, think of it in terms of we are trying to reprogram the nervous system. So we're trying to teach the nervous system now that actually it's okay. There isn't a problem there. We don't need to be firing signals off to those muscle spindles telling it to tighten up because there's a potential problem. The reason we hold for at least 90 seconds is because it can take around 90 seconds to 2 minutes for the central nervous system to kind of go, oh, actually, do you know what? There's not a problem there. So it's going to send that signal to those muscle spindles, tell it to relax. So by the time we ease off, all of a sudden that pain has just kind of alleviated. There's no more tender spot there anymore. So I'm just going to kind of keep this going maybe around about another 30 seconds or so, just to kind of see how we get on. And then I'll show you another way in which we could potentially shorten this area that could also be effective. But one thing to bear in mind is there's no set way of doing this. You're going to have to kind of move the client around a little bit and find that point of ease for your client. Okay, so what I'm going to do now, bringing this back. Now, how does that feel through there?
Much better.
Much better. And I can tell you what, that feels a lot softer. So another way we could have done this is I could take control of the client's arm, hold in that same point, and I may bring that shoulder up. It might be that I bring it back, however works to find that point of ease. Okay, so I want to give you guys a second example here, just so you can see it on a different area of the body. So we're going to look at the gastrocnemius now. One of the things we're going to focus on here is finding a position that's actually comfortable to start with. So you can use a bolster just underneath the ankles, or you can bring it up onto your knee, just like I have here. But we want to bring that knee into slight flexion to take some of that pressure off of the calf and bring it into like a natural relaxed position to start with. And then what I'm going to look for now is key kind of body language. So there's going to be areas where it's going to feel just out on the outside there, yeah? So on this lateral side. So just let me know when I hit that spot.
Yeah.
There? Okay. So again, I mean, what we suggest is naturally bringing it into kind of that plantar flexion is going to be the most shortened position, but it's not always going to be the case. So I'm just going to move your ankle around. can you let me know when this gets to a point where it feels most comfortable? So I'm going to apply that pressure. Let me know when it gets to maybe like a 6. 6, okay. So bringing that all the way up, how's that feel? No, bringing in. That's better? Okay. So actually that's where we're now going to hold this for the 90 seconds or so. And again, the principle behind this is going to be exactly the same. Hold for that 90 seconds to 2 minutes. Eventually, that's going to ease off. It's going to reprogram that nervous system, tell the body, do you know what? There isn't an issue here. You're going to be absolutely fine. Okay, some common mistakes that you can make now is too much movement. We're not looking to kind of sit here and just moving it around as fast as we can, trying to encourage it to relax that way. Sometimes it is just literally a simple movement, ever so slightly bringing it into position, and as soon as the client says they've got that point of ease, you're just going to hold it there. Don't worry about moving from this point, just make sure to hold it. The other thing as well is we want to make sure that there's constant feedback with the client, so make sure your communication is really good throughout this one. Third and final point is making sure we don't rush this. We want to make sure you're holding for at least 90 seconds. We want that nervous system to send those signals to the area where it thinks there's a problem, because when the body thinks there's a problem, it sends signals there, tells it to tighten up as a way for protection. We're trying to tell that body, do you know what? There isn't a problem here. So don't stress, send that signal, let's get it to relax, restore that tissue mobility back again. And to summarize with your session now, the main thing you need to do is always retest your client after. So we want to always make sure we're palpating that area, make sure it doesn't feel as tight as what it was before. If it is, you could potentially go back in, do it again, but always retest, have a little move around, bring them into that little stretched position, bringing it back, make sure that tenderness has gone down. And that is a wrap on today's video on positional release. So as always, if you've enjoyed the content, don't forget to like, comment and subscribe, and I will see you in the next one.